Start off this video by saying if you haven't subscribed, please hit that subscribe button. We're going to talk to you today a little bit about going to see a doctor without health insurance. What's brought this up, you'll see a lot of people, especially during the pandemic, they quit going to the doctor. They just refuse to go and things like that. Well, now you're getting people going back to the doctor and everything. A lot of people don't have health insurance. And here's how it worked for me yesterday. All right, you call, you make your appointment, right? Well, used to, they would send you all your paperwork to fill out before you came. This is a new doctor I've never seen before. My doctor died several years ago, and I haven't been back to the doctor since then. Well, they didn't send no paperwork to fill out, so when you get there, you go up to your window, they take your license, they ask you have health insurance. No, we need to copy your license, we need you to fill out all this paperwork. And then they hand you your paperwork and they said, all right, the first visit today is $147. And you're like, okay, here's my $147. Well, you go and you start filling your paperwork out. Well, then they're kind of rushing, so they go ahead and take you back, do your weight, do your vitals, all that, and then they take you to the room, you're still filling your paperwork out. Well, the doctor comes in while you're filling your paperwork out. He starts asking you questions, trying to get to know you a little bit, and starts asking you about your health history and all this and that. And you're sitting there and he'd ask you a question, you would answer him, but then you would notice him look down at his watch every time you would answer his question. So, you're sitting there, now you've paid, just call it $150 to see this doctor. You're sitting there, he never comes over and touches you, he doesn't look in your ears, your nose, your throat or nothing, he just sits there and listens to you. And he might make a little mark on something over there, write something down. And then he looks at you and says, okay, well, what we need to do is we need to start all over from the first, since you haven't been to a doctor, in 4 or 5 years, which is understandable. Well, he orders blood work, and you sit there and you say, yeah, I'll have blood work, but it depends on how much it costs. I can't afford no $200 or $300 blood test. Well, they take your blood and everything. You're still filling out this paperwork because you don't have enough time to fill it out. When you go up there and you hand it to the lady when you're leaving, and she looks at it and she says, all right, is this all your, you have to fill out paperwork now due to HIPAA to get your medical records released. And they were wanting any hospital I'd been at and things like that, where I had to fill a sheet out for each one of them. Well, I'm sitting there. They never reschedule an appointment or anything like that. They said, we'll get all your records back sometime next week. And that's all they said. And I'm sitting there thinking when I leave, I'm like, what did I just pay $150 for? To sit there and talk to somebody and tell them what's wrong with me, or, how I've been feeling, or what's been wrong with me in the past health-wise. $150 for it. That is why people will not go to the doctor. It's why people can't afford to go to the doctor. If you're going to pay $150 out of your pocket, you want something kind of done, not just sit there and fill paperwork out. And when they get your medical records back next week or whenever they get them back, when they call you back, guess what? You got to pay another $150 to go see this doctor. And this is not a specialist. This is a family doctor. It's not like a surgeon or anything like that. And when you go back in, more than likely when you leave that trip from the doctor, you just paid a total of around $300 to leave with maybe blood pressure medicine and sugar medicine if you're diabetic that cost you about $4 a prescription. So you just spent around $300 for $8 worth of medicine. That's what it's going to cost you when you go to the drugstore, more than likely, because a lot of drugstores, they have $4 or $5, medicine. That's usually what they write you if you don't have insurance. That's what they write you for your prescription. So that is why people are not going to the doctor. If you're going to pay $300, that's why most people just say, I'm not going. I can't afford to go to the doctor, and I understand that. Now, I'm seeing it. Back when my other doctor was still alive, he was $75. He come in and he sat there and he talked to you. You could be in that room for an hour, and he's going to sit there and listen to you, talk to you, ask you questions. And even though he knew you, for years, he's still going to sit there and talk to you. He didn't rush you out, keep looking at his watch. He let you say, or he asked questions that, he needed to know. It's very strange how things work now. It's all a big money racket. And let me put it like this. When I left, there was another person that come in that had Medicaid that come into this office. Her doctor's appointment and visit was $3. That's all she had to pay was $3. But someone without health insurance is in there having to pay, $150 for what? Just to sit there and talk just like I'm talking to you, and keep looking at their watch while you're talking to them. We're going to see what this doctor does. I'm pretty sure next week they'll call and say, all right, we need you to come back down. Doctor wants to see you. He's got a game plan, which is great. But the point of it is, that should be included with this first visit, because it's not my fault they didn't send me the paperwork to get filled out so they were ready for me when I came in. This is why people refuse to go to the doctor. It is getting outrageous to go to the doctor. Medicines, if you don't have health insurance, a lot of people cannot afford their medicines. Some people with health insurance cannot afford their medicine because of the way society is right now. They're having to pick and choose between medicine, light, power, food, water, that kind of stuff. It's just going to keep getting worse and worse and worse out here. I want to know your thoughts on this. If you go to the doctor and you pay $150 to sit there and talk to somebody for 15 minutes, would you at least expect them to look up your nose, in your ears, down your throat or something, instead of just sitting there beside his computer and looking at his watch constantly when he would ask you a question? Like I said, I'm going to give this doctor the benefit of the doubt, and we're going to see how it goes. But I'll get an update on you. If they call back what they decide, I'll put an update on here and let y'all know how much it cost, what they did for me, and you can get an idea of what it costs. If you got high blood pressure and diabetes, you need to go to the doctor. This might help somebody. If you are bad sick, I recommend getting to the doctor. If your diabetes are out of control, get to the doctor and get some medicine. I know it's expensive, but right now it's time to do it, because when the world goes down, you're on your own. You have what you have. Stay safe out there. Keep your head on a swivel. Always be aware of your surroundings and protect yourself at all times and your family at all times. If you're still watching, hit subscribe, and I'll do an update when they call back and when I go back to the doctor, and we'll do another how much it costs. And that'll give y'all an idea of what it costs in my area to go to the doctor without insurance. Stay safe, get prepped up, and if you're still watching, hit that subscribe button.